Let's talk about it with Martin Gower, former NHS Trust Chairman. Martin, have you rolled your sleeves up today?
I don't know.
Well, I don't know if you're serious then, because rolling your sleeves up is the indicator, is it not? Martin, Prime Minister announced, I mean, in the wake of course, West Street and the Health Secretary, this plan, sort of, more, local diagnostic hubs, more this, more that, using technology, getting rid of some of the unnecessary follow-up appointments that don't really serve any purpose. Is any of this going to make a real difference to NHS waiting lists?
Well, much of it isn't going to happen, Julia. I mean, I'm looking at the kind of details both from Wes Streeting and the Prime Minister. I mean, frankly, most of it's verbiage. Most of it actually was happening anyway. I finished my term in the NHS as a chairman in mid-2020. We were already setting up diagnostic hubs then.
What does a diagnostic hub even mean? Are these sort of almost effective little GP units set up in a shopping centre or in a supermarket, or?
No, I think it's a bit easy, but not quite that. I mean, where I live, we have a diagnostic hub in our local. It's called a hospital, but it's not a hospital. There's no beds there. It's really just a hub of a hospital.
Yeah.
But you can go there for an MRI scan. You can go there and have other diagnostic tests done.
But is this is stuff that you don't just walk in off the street? This is stuff your GP's referred you to?
Well, I don't think anybody. I mean, he's saying that you can make your appointments when you're around the shopping centre. That's not going to happen. It's not going to be in shopping centres at all. And why would it be? What he is trying to do is to say we can do more things closer to home.
Yeah.
I mean, Starmer is saying he's going to drag care out of hospitals into the community. Well, guess what? Unless that is combined, if you have a community service, particularly for older people, it needs to combine social care, community nursing, probably mental health care, because some of them may well be cognitively limited as well. Now, we did this in the last trust I worked with. We did it. We had a service called Home First. The local authority delegated the social care to us, and we combined it with our mental health care services as well, and it works. And it can work. It didn't work because anybody in Westminster told us to.
Just you made it work. Well, this is it. I mean, at the end of the day, if you're going to have more diagnostic hubs, more more MRI scans or whatever carried out, you're going to need more staff to do it. And the idea is that these things would be open 7 days a week, 12 hours each day, and actually be available. You won't shut down at 4 o'clock on a Friday, which would make sense. I've always found that quite bizarre. That's pretty much what happens in most NHS hospitals, apart from emergency care. But I mean, you're going to need to hire more staff. It isn't one of the biggest issues we've got in the NHS that they've got basically 120,000 plus staff shortages. They actually can't find the people to do the scans, the surgeons, the nurses, or the other people.
No, they can't.
So where are they getting them from?
Well, they'll get them from abroad, I suspect.
As Sam was saying earlier.
And then you meet all the language issues and all the rest when they come in. But even so, there are many things that could happen. And will only, I mean, my trust in politicians getting anywhere near our health services diminished by the minute. Today's lot from Starmer and Streeting today have just accelerated that.
Well, I don't know. I prefer the politicians to be running things than the NHS chiefs, because with all due respect, at least our politicians are vaguely accountable. NHS chiefs seem to be allowed to fail again and again and again and get basically a pay rise and a promotion.
I think that there's great merit in that. I mean, there are some very good, very competent managers in the NHS, people I've worked with who undoubtedly would have made it in the private sector as well. Very capable, very competent, very committed. And people say, oh, we pay them too much. I don't agree with that either, actually. If you compared my last trust, 8,500 employees, 420 million income, the chief executive of an operation like that needed to be paid very well.
Well, apart from the fact they get a much greater pension they would in the private sector, and apparently an awful lot more job security. Perhaps that's not a good thing. Isn't there really an issue that if you're not tackling the issue of social care, I mean, again, we're treating the health secretary as the health and social care secretary. We had that changing job title some years back. But they kicked that into the long grass over the Christmas period to saying, oh, well, you know, we're going to have another review. That's what we need, another review. Oh, it needs to be cross-party. I don't know anyone in any party who doesn't think we need to resolve the social care issue. Until you take social care into being a national government issue so that there is an incentive, you know, it's part of the NHS, so there's an incentive to spend money on the much cheaper social care to prevent the drain on the NHS resources of people being bed blockers or going into hospital unnecessarily. You're never going to resolve any of the issues in the NHS, are you?
No, it's not going to happen. I mean, as I said, in my last trust, where I was a chairman, the local authority delegated 500 social care workers to work in teams with community nurses and mental health nurses and other people in the community. That can be done. This is the problem with the NHS. There are plenty of local systems that work really well. Where I live, happily, we have some very good people there, and it works exceptionally well. I have no issues in South Warwickshire with any health issues at all. However, that's not because we were told to or given guidance.
Just did it because it was good management. Well, here's the thing. One of the things those want to do is use AI and use more tech and improve the NHS app. And so, you know, you can sort your appointment online. You can move it online. It's the worst thing. You get a letter. Again, a letter rather than email, even though you've given all your information to the consultant or the doctor. You get a letter saying, oh, you've got an appointment whenever it is. It's either already happened or it's at a time or a date you can't do it. You're not even, you know, you're at work or you're abroad, and then you try and rearrange it. It's virtually impossible to do that. No one answers the phone, no one replies to emails. Letting people make those appointments at a time convenient for them, but also rearrange appointments, but also get notified and, you know, reminded of appointments. Surely, instead of saying, look, every hospital and every trust should be doing this, surely the answer should be any hospital or trust that isn't already doing this, that management should be sacked because they're clearly complete idiots and utterly incompetent and incapable of doing their job.
That's a very fair point, Julia, but where are you going to get the replacements from?
Frankly, I'm sure there's some dogs that need a home, you know, some dogs' homes in January who would do a better job than some NHS Trust managers, surely.
Well, yes, and if you look at somebody with the right skills to do that job and you try and attract them from the private sector, you will be paying a great deal more than you pay those NHS guys.
I thought we already paid them a fortune too because we're competing with the private sector.
They are not, Julia, they're not really paid a fortune. If you think about it, people in the private sector don't have the media focus on them. I mean, an NHS Trust chief executive has about the same life period in that job as a football, you know, a Premier League manager does. And indeed,
well, they do if they're not very good. Well, I mean, if we need to pay a lot more to get good people, that's fine. What bothers me is we're paying a lot of money for people who aren't very good, which seems to me the issue. Martin Gower, former NHS Trust Chair, thank you very much indeed for joining us.